Praise the Lord. I want to greet every member of the church. I want to say that Ekuleo. As our daddy has said, we are not completely strangers in this congregation. Oftentimes we come and fellowship here. And the church has been a blessing to us also. We give glory to his name. I want to thank the pastorate for the opportunity given unto me to come and bring, to share in the knowledge of the health care. And I also want to appreciate the entire church council, the deacons and the deaconesses. I did not take this opportunity for granted, and I know that by the grace of God, we will all be richly blessed in Jesus' name. Amen. Also, the pastor has given me a free hand to choose any topic of my choice, especially in the area that is the area of my core competence. And that is going to reflect when we start showing that area. I am a specialist in the head and neck, ear, nose and throat, head and neck, and that's what we are going to deal with. Also, much appreciation goes to the Baptist Convention, who has made it a routine, a thing of priority to make sure that our members benefit or are being informed and taken care of in the area of physical health. After we know that, after we are being fed with the word of God, we don't want to take for granted the area of physical health. So we should continue to appreciate the Church of God. So before I go into my talk, I would like us to have a word of prayers. Almighty Father, I thank you for this morning. You are God who you are. You are God, great and mighty God, great in counsel and mighty indeed. This morning, I am that I am. We say that you are our God, Jehovah Rapha. Father, Lord, send your word this morning to heal, to deliver, to give us knowledge, wisdom that will set us free in the name of Jesus Christ. I humble myself before you. I hide myself behind the cross. I say that I know that I'm not competent of myself. I'm not sufficient of myself to think anything of myself, but my sufficiency is of you. Of your people. Amen. Jesus Christ, mighty name, we have prayed. Amen. So, this year, they have done their own part again. Nevertheless, so, giving a health talk, you know that it will not be new to health practitioners. But usually, there are usually a dilemma. When you want to give a health talk and you want to face people who are not primarily health practitioners, so you need to look for the most appropriate terminologies, to be able to communicate your mind. So this is the usual dilemma we get into when we want to do this. But of course, we usually have some templates to follow. So today, as I've said, I'm going to talk about your life, living a healthy life, your ear, nose and throat, your head and neck. Well, I have a particular outline which I cannot see now, but I'm sure that I'll shortly be able to see it. And the outline is I spell out what I want to do. Again, the aim of this health talk is to bring to us awareness of some conditions. To also bring to us some health tips, what we need to do. This morning, the aim is not to honor or to lift up diseases
or to call them the names which they are not. As you can remember, I said our God is the God I am that I am. So He is who you call Him in your life. So if you know Him as the God that heals you, He is here today. Not only the God that heals you, He is the God that makes you healthy. He's also here today. And we also need to know that Bible says that my people are destroyed because they do not lack knowledge. So also giving ourselves knowledge of diseases is not because we rate disease higher than God, but because so that we can avoid what we should avoid, so that we can also do what we need to do. And that's the thing. We also like to make reference to 3 John chapter 1, verse 2, that was written and said, and I wish above all that thou mayest prosper and be in health, even as thy soul prospers. So we know that the first prosperity that we need is the prosperity of the soul. Therefore, the prosperity of the health or healthy life will follow. So someone that prospers in soul knows that he cannot be an ignorant. He cannot say that I'll only be reading the Bible. I will not read the book that will expose me to know things and those. In any case, all these things are even in the scriptures. But some people have brought it out to us. So, for us to enjoy the prosperity of the soul, the prosperity of our health must come along with it. And that's the essence of our coming here today. In trying to do this, to come up today, I tried to prepare the slide, then I did another one. And now discovered that, so how will I do 2 slides? So I tried to match it. So therefore, today, we are going to be practical. It's going to be practical, whatever. By that, I mean that I will have illustrations to which I will talk. I know by the time I see those pictures, all the illustrations I put here were primarily tutored by me. So it's easy for me to, once I see, pick it up and then begin to let us know the key points that I want to bring out. Projector, sir. Okay, 1 minute. Okay. Right. So as I said, it's going to be practical. Now, I will also take it, yes, please. Next slide for me. I've talked about this one. I've talked about this then. Yes, I've talked about the aims, objectives then. I said it's going to be practical. I want to encourage us to, there are some people have ideas and beliefs that you can't believe it. If you know what people believe, wow, about their health, you can't believe it. All these things will come to it when I see the particular things. I will let us know. So next. Well, I like to introduce our head and neck. Please, no, it's too fast. This one is too fast. Okay, so you know everything that is in any part of the body, usually they are also in the head and neck, but in a narrower space. And by this, we know that our body or the head and neck accommodates virtually everything accommodates in another place. Therefore, those things, by the time they are so little, they begin to give symptoms. They begin to give various kind of symptoms. Again, as part of the aims of what I'm going to do today, I want to look at reimagined conditions and then what the world has made to become more commoner by reason of what we have passed through, especially talking about the COVID-19. And now we begin to see some more conditions more commoner than it used to be. That's one. Also, by virtue of some systemic conditions, diseases, diabetes, tuberculosis, fungal infection. Also, by virtue of the habits that people do, especially exposure to noise, the social life of people. So that will bring to fore some of the things that we'll talk about. Next slide. Next slide, sir. So now, in this next slide, you just see, so this is a condition that, if you see this, it's a very simple, benign condition. This young lady has been carrying it around for about, according to her, about close to 10 years. She's carrying it around because she doesn't have money. But by the grace of God,
were able to do it for her so that she can see that it can be done. In short, people have volunteered to help her, but before the help will come, she would have spent the money they gave her. But eventually, we were able to solve it, and that's our final picture. Now, this condition is commoner in blacks. So it usually causes when there is injury to that part of the body, and that it will cause excessive growth in that area. But there are things that can be done to handle it. Now, after removal, you can see the fourth quadrant, that's where we find there. But we also need more treatment, otherwise the thing can come back. So I'm just bringing out this, that it's not everything that we have, that people have, that is untreatable. Many of them very, very treatable, but people tend to cover it. Okay, so some of the problems we also have in this environment is problem of ignorance, problem of people hiding their condition, and also problem of financial problem, as well as problem of attitude, and then calling things what they are not. So people would have explored some other avenues that will not lead to anywhere. So I will get there when we get there. Please, next slide. Next slide. Now, so I want to show us this slide to bring up some of the things that can happen in the head and neck, in the area of the nose. If you look at the first slide to your left now, so that, I don't know whether it's clear. Okay, so that's a denture. It was removed from one, Mama is about 84 years. So she was using denture because as elderly people, the teeth were gone. So I think the children gave her denture. But dentures have expiry dates. So therefore, because as we grow, as people grow, the body also begins to shrink. So the denture that the person was using, is no more fitting very well. So one morning, Mama wanted to take drug. And then as she turned up to use her medication, the denture fell back and it entered into this. And the dangerous thing about denture is that they have multiple sharp points, because that's why they used to hang it. Some people have lost their life because of denture. As simple as it is, removing it is not easy. Because of the sharp ends, it can injure blood vessel and patient can even bleed to death. So what's my advice here? People that are using dentures, they should pay attention to the expiry of their denture by regular checkup, so that they should remove it when it's getting old, and then they should replace it and let it be tightly fitted. And if people are using dentures, if they want to take medication or they want to eat, they normally tell them, you can remove it. When you finish, then you can put it back. So that you will not be swallowing denture thinking that you are swallowing drugs or swallowing food. Now, the second picture on the right, we have not yet operated that young man. He has a growth inside his nose. This growth is something I will talk a little bit about. Is a simple growth. It's not cancerous. It's simple. But we see more of it these days, both in the young and in the adult. And the exact reason we have not been able to pinpoint, but there are some suspicions. One of the suspicions is the fact that of course, that one is documented. People that have been having catarrh for a long time. But lately, we discovered that some people, I don't know what people put into their nose, or people are living in houses that the humidity is very high. Maybe they built their house close to river, or the place that is congested. So we find this thing to be very common. So people that are living in that place, so they have fungal sinus infection, fungal ear infection, because you know that. And these people, is not because there is anything in their body that is not in other people's body. No. But fungal diseases try to grow in a place where they have opportunity. We call them opportunistic infection. So what can these people do? Number one, if somebody has diabetes, we should take good care of it. We should treat it very well. Number two, people we should avoid pouring water into our ears when we are bathing. It can be a cause of the place becoming moist, and then fungal infection can grow. Number 3 is that we should, if we have the opportunity, some of us that we know that, especially at this kind of season, we can buy dehumidifier into our houses. So some people have houses that they have, maybe they have ground floor and what's it called now? Underground, basement. In the basement, the humidity is higher. So if you are living in the basement or your house is close to the river, so you can get dehumidifier. Put it in your house. It's going to help you to draw out excessive humidity. And some of these conditions can be prevented. What are the other things that can be done now? Some of the things that can cause this thing also include exposure to some of these fungal agents that are implicated. For instance, people that are working in farms. Because they say fungus or fungi, they are ubiquitous. Ubiquitous means all over. So there is no place where they cannot be found. So it behoves on us, if we are farmers, when we are going to the farm, we may use face mask because that's this thing. Or if we are working, maybe cement factory, or we are doing furniture work, you should use face mask. It will help us to ensure that our nose is devoid of agents that can trigger the growth of this fungal infection. The other thing that we can do, and is a home remedy, saline douching. So that saline douching, you can just put, so how to make saline? If you add an aliquot, a pint of water, that a pint is 500 mils. 500 mils. So into 500 mils, you will add half of a teaspoon of salt. So then it becomes saline. So that one we can use for nasal rinsing. Yes. But if we cannot do that, we can buy normal saline. Normal saline as drops. Put it in the nose. It helps to make sure that that place, because God puts things like a paddle of the canoe paddle in our nose. This canoe paddle, they make sure that the nose does not, the content of the nose, they do not stay in that place. They continue moving. Okay, but if they had been contaminated, maybe by dust or fungus or something, so they are incapacitated. So when you put saline, just like if you put fish in water or put water on fish, then they move up. They become more buoyant. So if we put saline drop in our nose, it helps us. The other thing we can do is it's called steam inhalation. But this was well abused, especially during the COVID-19. Some people even did steam inhalation. Steam inhalation, what's the advantage? Advantage is that it will help the nose to open up. When the nose opens up, the blood vessels that are there, they will open up. And therefore, any bad thing that is there, it will be carried away from there. You know, when the place opens and their blood vessels are opened up because we have applied heat, what is going to happen is that the waste products at that place will be carried away. And then the risk of it staying there and causing infection is minimal. However, we should avoid overeating our nose because we can also cause mucosa immunosuppression. So, because if we overeat that place, the things that should function there, they will also not be able to function. So what do? We make sure that we don't stay under the heat for more than 3 minutes to 5 minutes for our steam inhalation. The next one I want to show you is that daddy that is in that place. He has that swelling in his neck. That swelling, it can mean anything. But many of the times, if it is there, it's a dangerous sign. There is a Yoruba that says that Oniromi to Njoni Lori Omi. Something like that. So if you see something on top of the water, It's dancing. Most likely there is a cause underneath. So a swelling in the neck like this is the tip of an iceberg. There is an iceberg under. So I wouldn't want to talk more about this. When this kind of thing happens, we should just go see head and neck surgeons. But the information I want to pass across is that many of the times, this kind of condition, it starts with the individual complaining that the ear is making noise. Although I'm coming to that. The ear is making noise. Because where this thing is coming from is just sitting on top of the middle ear. So that's the simple symptom that they can. The other time they can just say they are feeling that the ear is blocked. And then they will be insisting that they should wash their ear. Washing of the ear cannot solve this one. But some people, they have some impression that this was, but no. Please, next slide, so that I will not talk too much on this. So now, to just say that some of these are also conditions that can happen to the neck. If you see on your left side, it's a swelling. It's a developmental anomaly. That boy is a child. Is a child like 7 years. But this kind of condition, that's why I introduced myself, ENT, head and neck surgeon. This patient is supposed to be taken to head and neck surgeons. If he's taken to some other places, they may help him to put knife and drain the pus. But it will make the thing difficult to treat. So the boy's pus has been drained before. That's why while operating, it will be a bit more difficult for us, and we had to open it more bigger. Now, so the next one is this one on your right now. It's interesting to note that that's what we call goiter. There is a common belief that you don't remove goiter. I was seeing one patient in my facility, and the person proved it to me that you don't remove goiter. And he told me of a family that one of the children, after removing goiter for their mother, they became bankrupt. The children that were initially multi-billionaire. And they said the woman warned them that the goiter in her neck is the bank for the children. She said that is their bank, they should not touch it. But the children, they are billionaires. They are in the US. So that's all. But this woman, the two of them, the first one above, that's what was removed from there. She has not gone bankrupt after we removed it. The other woman, in fact, the other woman, lower down, remove it, you don't even know something has been removed, and she's doing well. Okay. But it's also, we should also mention that this condition is commoner in women because of the role that God has given to our women, manufacturing babies through the help of God. This organ, as you see it, is like the powerhouse for all the metabolic activities in the body. So when you see it enlarged, it's because of a number of things. So we encourage that as we are growing up, in fact, it's common in this Ondo state and our states where we have hills and mountains. So it will be good if we take iodized salt. Yes, so iodized food will help us. Iodine deficiency has been identified as one of the major causes of this particular condition. In these two people, they are benign. It's not creating any problem. In some other people, it can cause them to have for the eyes to be protruding. Eyes to be protruding. It can cause heart problem. It can cause them to be losing weight. They be sweating excessively, losing weight, eye problem. It's unfortunate. I had a patient about 3 months ago. They called me to see the patient. I saw. The patient had similar thing. The people that called me wanted me to operate. No. I said, no. I will not operate. I will not operate this one. The lady is a young lady. She's about 29, 27. In our own case, our eyes are protruding. In our own case, if you feel a pulse rate over 110 into 120, BP hitting the roof. So the mother brought her. They were trying to pressurize me to operate the child. They called me from one hospital to come and see. I said they have to come over to me. So they came. I said, no, this is not for operation. I now sent them to the endocrinologist to treat. By the time the endocrinologist saw, wow, she called me back and said, wow, she was just thanking me that for doing that needful thing, for not, that some people would have just, I said, I will not double at it. But lo and behold, another patient from the same company that the lady came to me, I think last week Sunday. And so after coming then, I was seeing them, and she told me that one of her friends says she met me. I said, can you go? I said, yeah. But as she wanted to enter the car, she said, the girl is dead. Wow. And what am I trying to bring out? What I'm trying to bring out is that dead, not because we operated. These two people are alive and well. This one, upper one, operated about 3 years ago. This woman operated last Sunday in April, the one below. So, and the thing has healed. So these ones are alive and well. But that one, possibly they could not wait for maybe they feel I'm slow. They went to approach this thing, and maybe some people tried to do it, and the lady is dead, 27, thereabout years. So what I'm saying is that when these things are there like that, we need to see appropriate people, not people that are just interested only in maybe they just rush into anything. No. Did God help us in Jesus' name? So it's not a reason to fear our mummies, but that we should do the needful. What are the needful to do? Let's be taking iodized diet. I think there is iodized cassava now, if I'm right. Yes, there is. I saw it at School of Agriculture, FECA. There is also iodized salt. It will be very, very helpful. And if after doing all of those, this kind of things happen, let's approach the correct place. Next slide. Okay, so, yes. So the first slide by your left, just to bring a child there for us to see now, is a small child. You can see how the face is deviated to one side. So he has a facial nerve palsy. Nothing happened to the boy. He just went to school and he came back, and that's Bell's palsy. Bell's palsy is idiopathic, cause is unknown. But many times, viral infection can be a cause. So when it's seen, if it's brought early, it can be treated. But the healing is not going to be immediate like that. It takes between 6 weeks and 6 months, and they get well. So I will encourage our parents, even what we call simple catarrh, let's treat it on time. But many times they are viral. Okay, so I don't want to talk about this once again. I've talked about them. So this lady is in a federal government college, and they had to send the girl back from school that the child is bleeding from the nose, that they should not bring the child until the thing is done. They removed it, and the child is fine. He's gone back to school after 2 days. And that's the other one. This other papa, diabetic, has nasal polyp. Fungal is fungal infection. And so fungal infection is very stubborn to treat. That's why we should take precautions and do the needful. And I've mentioned our precautions to us before. Next slide. Okay. Okay, I just want to say that as part of the attitude or attribute to be condemned is not approaching healthcare on time. Okay, so this lady also, the one by your left, we operated her. She came from Ibadan, of course. And the thing has been swelling there. I don't know. But eventually she came around. They are from Akoko. Came there, and then we operated. And then that's just to show us. But the thing is now fully gone down and it's fully resolved. Now, the other side, this one is also a result of quacks. Also, or a problem is, well, do I say quacks now? When government, they said they are doing free health, all these things that they are doing, and then she doesn't have money. She goes there to people that they will not do proper something. So the thing has been there for about 20 years. She has been operated 3 times. And the thing is like that. But eventually, by the grace of God, we were able to remove it. Though the facial nerve was affected and her face was looking like, you could go back. And looking like this because facial nerve is affected on that side. So, but she's improving. Next slide. Let me see the next one. Yeah. So, okay, so now I want to also call attention of our parents to simple things. See that boy. See that on your left-hand side. the father is an Okada rider. I think second or third week in December last year. So I don't know, the boy swallowed the thing. By the time they brought the boy, the parents were not there. The boy virtually had stopped breathing, and they don't have cover. So, but eventually, by the grace of God, we were able to remove it. The boy was revived, and the second day after removing it, the boy was still in the hospital. The mother gave the boy granite and barley. He aspirated again. So we have to now put tube. Okay, so what's the lesson from here? The lesson from here, okay, that thing, the mother used to use it for decoration. That's decoration pin. That's what they swallowed in the airway. So it was removed. So what's the lesson here? Lesson here is both the teachers and the parents paying attention to the children and warning them about, fiddling with objects in their mouth. Okay, so also in the ears you can have things going there. This boy on your right hand side with blood coming, it's also foreign body that they put there. They are taking the person to somewhere. They attempted removing it, but instead of removing it, they damaged the ear the more and it started bleeding before we saw. Some of these things also, to be truthful, even in the hand of specialists, is not easy to remove. It may need cutting and drilling through the bone. But in this boy, we didn't have to do that. We eventually come out. But several of them, especially if it's a round object that will be slippery, so it may not be easy. And some of them, by the time they get to a particular place, they are stuck there. So instrument cannot go behind it to pick it. So you have to do major cutting and drilling the bone to widen the place. The other one is also a common one, which I'm supposed to talk about very much. The one below on your right, with that pus coming from the ear. It's very common in children. Now you see it in adults. Though when we see it in adults, we become very suspicious, but very common. So what are the causes of this thing if it's in children? Then children are by nature prone to having it. Why? Because the pathway to making sure that this pus does not stay there in children, when they are small, the pathway is still very, very large and is horizontal, not slanting. The pathway is at the back of the nose. It's horizontal, and at the same time, some of the mothers, when they want to feed the children, they feed the children breastfeeding. When they are tired, they lie down, feed the children lying down. So some of the food goes back and then fill the back of the where the thing is supposed to drain out inside the body. So it's like you are having a blockage from inside, and therefore normal collection must find alternative routes. That's why it's commoner in children. So, but when we find it in adults, we are suspicious, and we want to know what is the reason why it happened. Many times it's due to immunosuppression, or many times it's due to a condition which I will mention later. So the danger in this thing is the fact that, yes, pus is coming out, patient can lose hearing. That's number one. Number two, this pus can go into the bone and it can escape into the brain. And once it escapes to the brain, we will say the horse has bolted. It's almost getting too late at that point. The patient may not survive it. So that's why we should pay attention. So if a child has this, what are the things that the mother should do? Number one, you should approach the hospital. But before then, we can take something that can suck out the pus, like capillary action. I don't know how to put it in Yoruba. That can try and suck it out by capillary action. So toilet roll will do that. If you put a toilet roll there, some of these things, it will be following it, especially if it's mucoid. A careful, I want to say this is all sense of responsibility, use of cotton bud can do it. But it's for dabbing, not for pushing in. Because cotton bud, by nature of how it is it has a big head. So if you put it there, you are likely going to push in some. But if you put it at the entrance to ensure that it can dab it out, then it will be able to do the work. So, and again, you now ensure that water should not touch the air when they are bathing. All of this will ensure that at least you don't add anything extra. So, and then when they get to hospital, they know the next line of action that they can follow. Is there any other one? This next slide. Okay. Yes, I also want to use this to illustrate something. Well, in this young lady above, in our own case, it is a financial problem that made the thing to be that long. Yeah. She was a she was a copper. She had it even before she went to do youth service. And she couldn't even raise money for surgery till she finished surgery, till she finished her youth service. And if you look at that thing very well, you will see something like fat inside that bone. It's supposed to be empty. That fat is filling all the air spaces in her head. The lady cannot sleep. The nostrils are blocked. All the interior part, they are also blocked. The head is heavy, according to her. And that's what we're able to do. We're able to remove it, but not long after, the thing reaccumulated again. Not by any fault of ours, because again, once the thing becomes chronic, as I told you, the ciliary action, the canoe paddling that God has put there to remove waste and rubbish, they are already irreversibly injured. To the extent that even when you remove the disease, except you leave it open, you leave the head open. And how can we leave our head open? So, once another thing comes there, they are going to be static. So, that's the challenge that she's having. This is another man. We are yet to operate this. Of course, I think he absconded. You can't even see him. We are yet to operate him. This is another. It's a swelling. So, not all of these swellings are dangerous. Not all of them are malignant. Some of them are benign, that if they are handled on time, we'll be able to take good care of them. The danger in this particular one is that whether if it erodes into the teeth or the teeth erode into it, the mouth, our mouth is a destination for many things that are not clean. The mouth is not as clean as we think. The flora that is there is mixed flora. So once anything in the mouth, that's why whether the human bite or dog bite is dangerous, it will not heal on time except proper thing is done. Because the bacteria in the mouth is not, they will not allow the thing to heal on time. So if the teeth get in touch with it, the infection is usually very, very rapidly, very, very aggressive. We lost one man recently in one place, which I would not like to mention. They called me that this and this, the man is there, and I told them what to do. But the man was in pain. So the people that were there, they just gave one analgesic that would make him to sleep. Somebody who had odontogenic infection and was in pain, they ought not to give that kind of analgesic. They should give another type that will not impair his sensorium. Eventually, the man died before one gets there. So, now, all of these things I'm trying to point our attention to are talking about the fact that conditions that affect the head and neck, they are treatable, they are curable if we do the needful. Now, I will pay attention to 2 or 3 other ones. Maybe they are not here. Let me, next slide. If they're not, okay. Okay, yeah. I will talk about this one. This one comes as a congenital problem. That is, they born the child with it. So this child, the one on your left, had multiple congenital anomalies in the head and neck. So that place was open. The lip was open. And the roof of the mouth also was open, just like this boy and like this girl. This girl is older. But also, this girl, the ears also, twisted, has multiple abnormalities. But they are treatable. Before now, many people, they even throw the children away. They stigmatize them. We call them cleft lip and palate. There is an NGO that has collaboration with Federal Medical Center Award. I'm sure they has it with Unimed too, that treats them for free. So this girl, that girl, she's now about 5 years or 4. And they brought her since since immediately after birth, before 1 month, they have brought her, and we have been treating. So we treated that lip at 3 months. Close it. So we had to treat the mouth, the throat at 1 year. But lo and behold, the girl also has heart problem. So we had to send her to a place. They treated the heart problem. But in the process of doing that, other complications took place. They had to put something in the neck. But eventually, the child is still well now. So the child now was almost 2 years before we could repair the throat. We have repaired the throat too. The child is well, alive and well, even up till now. Still came to clinic recently. Now, but this woman, she's living at Oda Road. She says she does not know that anything like this can be done until somebody called her and told her. And this girl now, we have repaired it, and the girl is ill and natty. I'm just trying to say that cleft lip and palate is treatable. For the purpose of this, if anybody has people that have the condition, you are free to, if you get my number, which I can put here, give them my number, they are free to call. They will be treated free of all cost at Federal Medical Center or War. So they should not injure the child, they should not harm the child. So next slide, let me see. Yeah. Okay, yes. Okay, there is a note. This case, a pathetic case. The young man, about 26, now late, had this condition. You can see that the whole of the neck is swollen. The throat also, there is something in that throat. The throat, whether they use a hot iron to pierce it, or she used, they said concussion, and they damaged that place for him. This boy, I know that we don't do that in our church. It's from Idori. And he said he's not feeling fine, and they took him to a place where the father said that is a church. But they make incision around his neck, and they put him in the church. They did not bring him until his legs are swollen and everywhere is swollen. But even the parents, I think they have money, because I first saw them in one hospital, and I said they should do this and this and this and this. Okay. By weekend, they call me that patient has gone to FMC. And I saw him again on Monday. I said they should do the same thing. By Wednesday evening, they were not patient. He said they had left. The patient died on the road. And we're already doing what we're supposed to do. What point am I trying to make out here is the fact of we give various names to conditions that we find in the throat. They call it belu-belu. They call it various kind of names. And they said, there's another one I will even mention. A pastor, I should not mention the church, very popular church. I think he's not representing his church. Something similar to this. Once he told them what they are supposed to do, the wife stood up and said, no, he must not take injection. So they tell them that they must not take injection, that if they will take it, they will die. Eventually, they were doing scarification, they are doing all sorts of things, and they wasted the boy's life. The man also, we said, this is what you should do. The woman said that until I had to call other pastors that are in that same church before we are now able to take care of the man. And even then, once we did what we are going to do, they discharged against medical advice again. So we need to disabuse our mind against some wrong beliefs. There are some wrong beliefs, like they don't take injection for some things. I don't even encourage injection, so I don't encourage it because of the various damages that it can do to the body. But when there is need for treatment, let's take the treatment. Now, follow up on this. I want to talk about a particular condition that is now becoming a health problem now. Reimagine. Number one is called diphtheria. Diphtheria, they used to take vaccination for it. Please, if we have children that are having sore throat, let's take them to hospital on time. Let them have appropriate treatment. Diphtheria is not usually treatable. That's why they take immunization for it. But unfortunately, they are seeing some of the variants coming up. So if anything happens, maybe a child is having repeated sore throat, or and swelling neck, please, let's take him to hospital for immediate attention and treatment. I think those are the things I want to pay attention on. So I want to mention one or two things briefly. I know my time is fast spent. And what I want to mention is about exposure to, or let me say, a condition we call tinnitus. Tinnitus is defined as perception of noise in the ear. Perception of noise in the ear can mean several things to several people, but the causes are so many. There are preventable causes, there are non-preventable causes. I mean, non-preventable in the sense that just have to occur, just have to happen over time. Preventable causes, exposure to unduly loud noise. Students that use headset and put this in and direct it to their ear is not in their best interest. By the time you do that consistently, your ear age will be older than your normal chronological age. So your ear is degenerating faster than your normal age. You should avoid that. Now, number two is indiscriminate use of some drugs, some injection. As a person, well, they said the program is online. Maybe I will not want to say this, but which I say there are some anti-malaria that they give. That I've had to write to government. They had to come to me from Abuja. In my place of work, I have to write them. Now come. If you give this drug, it's causing problem. I'm the one seeing the problem. And they had to send the director of their this thing from Federal Ministry of Health. And they called my name. They went to meet the director of pharmacy, Mama Omotoyibo, when she was there. And she had to send them to me. I said, come, let me see you. Because these are the things that we have discovered. So there are some particular anti-malaria drugs. They give it through the vein. They say it's anti-malaria. He's using a sledgehammer to kill an ant. He has caused so many irreversible problems. So I'm not mentioning names, but you can guess what the name of the anti-malaria is. Please. That is one. The other thing that can cause tinnitus is when people are hypertensive. Long-term hypertension can also be a cause of it. Any other condition in the ear can also cause tinnitus. When we have it, what we need to do is to approach our physician. Things that people think about when they have it is that, hope nothing is wrong with their head. In actual fact, we cannot say or whether positive or not until after the person has been investigated. Because some people may be incubating aneurysm, a blood vessel that is like basket that has ballooned up, may be the cause. So let's do the needful. Some systemic condition can also be the cause of this tinnitus. Diabetes can be the cause of it. Thyrotoxicosis can be the cause of it. Toxic medication can also be the cause of it. So let's pay attention to all of this. I also want to mention briefly situation of having hearing loss as well as imbalance. We call it vertigo. People are having imbalance. Sensation of imbalance can also be due to use of toxic medications. In some cases, it can be due to the fact that age that is causing bone problem. In some people, ordinary change of glasses can be the cause. But the most common cause is in the ear. So when it happens, we need to check our ears. However, what are the precautions for this ear problem, tinnitus and vertigo? Avoid those toxic things. When vertigo happens, individual concerned should make sure that you sit down and you hold something tight. You avoid turning your head to the part of the body where the thing is happening until you get to hospital. You avoid driving. So then you have to be driven by someone if you have your own car. So these are the simple things that we can do, at least for hearing conservation. And then we approach our hearing physician or surgeon, and then they do some tests for us. So I think this actually has summarized most of the things that I have. Though I have some write-ups in what you can just let me brush through it, which I don't intend to go through. Yes. This young girl also has, please. has a hearing loss, and we had to put hearing aid. Hearing aid. So hearing loss is treatable and they can be helped. Even some that cannot be helped by hearing aid, they can have cochlear implantation. Bill Clinton uses hearing aid. When people need it, let them take it. It's not a death sentence. Let's take care of ourselves. I think that with this, I've been able to mention at least most of the things that are common. But lastly, let me mention that some people used to complain of something in their throat, and they are very angry and they are very fearful about it. Most of the time, there is nothing there. Feeling of something in the throat, most time there is what? Nothing there. People would have exploited them. The commonest cause of it is because we are having reflux. Our food is coming up. What is the precaution? Precaution is that we don't eat late. Eat your breakfast like a king and your dinner like a pauper. When you want to sleep, make sure it is after 3 hours of eating. When you want to sleep, lie down on your left side and use 2 pillows. I think these are some of the small things that we need to know. So if we do this, some of the things that waste our money unnecessarily, they will not do so. But if there is voice problem of 2 weeks that does not resolve, please see your ENT doctor. I want to stop here because if I say I should continue, just thank you very much.
Please, can we be more generous? Can we be more generous? We want to appreciate you, sir. Thank you. God bless you. A specialist has spoken. And we want to appreciate God for that wonderful teaching. At this juncture, we would like to welcome questions. Please, those of us who have questions, I would like for us to raise up our hands. And while you are coming here, please just have prepare your mind to ask your question. Don't give us another lecture, I beg of you, please. Can I see our hands up? Those of us who have questions. Okay. Baba Dikin Adile, my brother, I don't know your name, but okay, after today's meeting, let's see so that I know you are not coming for the very first time. Mama Sani, Baba Sani, and Korea Folabi, she afterthought ni abi. Okay, please, in that order. Okay, Yaru. Okay, Lati Abuja. Okay, please, all of you are being accommodated. Please just go straight.
Praise the Lord.
Hallelujah.
I want to ask questions concerning kata, frequent kata. I have somebody very close to me, and is this kata every time. And especially so early in the morning, early in the morning is always sneezing and kata. We have tried all we think we could, but this kata refused to go. What can we do?
Okay, thank you. Number 2.
My question is question. I have someone who sneezes all the time, always sneezing. So I want to know what treatment.
Okay, feeling dizzy.
Sneeze.
Okay,
with a lot of discharge.
Okay.
Yeah.
Okay, thank you. Mama Sani?
I think my questions is of 2 types. The first one is that maybe waking up in the morning, I discover maybe is this symptoms that they used to call it, I don't know, it was truth. So I want to know the cause of that one. Then the second one is that though I used to have catarrh, then I was treated. But somebody said I should not be using perfume, so that thing will not come back or something like that. I just want to know maybe that is true, so that I will stop using it.
Okay, thank you. Daddy Sani, can we have you, sir?
That's a case I saw it, mother and child. I'm very close to the family. A baby girl, just little girl, about 2 months ago now. The baby has a hole inside her mouth. When you open the mouth, you see the hole. Apart from the one that goes to the esophagus, it's there now. So the girl could not suck the breast. The doctor said that cannot be operated upon until about 9 months. I just want to confirm how they have taken the baby to FMC. So, but the advice they gave was that it cannot be operated now until about 9 months. I just want to confirm that because I know to know the kind of advice I can give to the family. Presently, the lady cannot, or the baby girl cannot suck breast. We don't have to put the milk inside the container and take small spoon, and give the baby. They will be taking it small like that. So
Okay.
I just want to know the advice.
Okay, thank you. Baba Konesa, can we have you?
My first comment is that when we started praise worship this morning, I was covering my ears because the speakers were apparently too loud for my ear. Thank God he was talking of ENT. I think constant exposure to loud noises, like he said, can cause problem with the ear. And I experienced this one during the Civil War, where many of us lost their hearing as a result of frequent loud explosions. Yes, in fact, some were permanent and some were treated. I don't know if the technology has gone beyond treatment now, or if there's something that can be used to save people from such experiences. Okay. And also, I'd like to know if there's any relationship between dizziness and ENT problem.
Okay.
And lastly, many of us are not used to the I don't know whether to call them biological or terminologies that were used, and if arrangement can be made next time for interpretation for many of us who are not that vast in this language. Thank you.
So grammar to put you. Okay. The secretary.
Praise the Lord. My question has been asked anyway, that why are some people prone to cold? Because I discover some people, it did not just start all of a sudden. I've seen young children, as in of younger ages, that any little, maybe in every, I have a typical example with me. He catches cold anyhow. And I'll be like, are you the only one in this house? Before you know it, it will start sneezing. And you know, this thing, it did not just start. Meanwhile, I have a colleague at work, the same thing. The moment it's cold, in fact, I always tease him. If I give him a call now and he's sneezing, I'll say, you started again. Is it because we are in cold season? You say, excuse man, because you hear me. And he's a man. So, and he said this thing was there right from when he was young. So I want to know the reason why some people are prone to cold, and even at any age. It doesn't go by their ages. Thank you, sir.
Engineer,
sorry. Praise the Lord. It just comes to me just now that I should ask the question. We have a sister that before she got married, she had a pregnancy for the person she wanted to get married to, and he decided to abort the pregnancy. So she aborted the pregnancy before they go to the altar. And at the end of the day, she has a gutter. So she went to operate the gutter after the termination of the pregnancy. So see this moment, that sister, she has not been conceiving till this moment. So is there any connection with the gutter and the pregnancy? That is the question.
Okay, thank you. Okay, please, Baba Professor.
Thank you for allowing me. From our speaker, the preacher today, Dr. Adeniji, and our church secretary, from my professional point of view as an architect, most people, mine is more like a comment, but it's to support the doctor when he will be answering those questions. Most people who want to quickly build their houses within 6 months, they will put up blocks in the foundation and raise it up without doing what we call the oversight concrete. They call it German floor. The German floor oftentimes is meant to make sure that water does not seep from the foundation to the floor level and beyond the foundation, the German floor. But most people, because they are in a hurry, they want to say, I'll finish my house within 6 months. They skip the German floor. And it leads to what we call capillary system of blocks soaking water. It's just like you put sugar, a cube of sugar in water. It will soak it up. And oftentimes, people who live in such houses, they experience what the secretary mentioned. They are always experiencing catarrh and cold because they live in damp rooms or damp houses. Thank you very much.
Okay,
Mine is more like a
okay, thank
comment.
you, sir, for that comment. Baba Doctor, can we have you back, sir?
Thank you so much, sir. Thank you, Prof, sir. I mean, that has been more, that's added value to what we're saying. Yeah, so starting from the first question, frequent catarrh, early morning. So, having frequent catarrh or clearing the throat early in the morning is a combination in etiology. Now, etiology is both traceable to allergy as well as reflux. Now, the way I will explain it is this. When we sleep, we lie down. Part of the acid in the stomach comes up. When the acid gets to the throat, the throat is not meant for acidity. The pH of saliva in your mouth is 7. So it's supposed to be neutral. So when the acid gets to the throat, it's going to burn the place. When the saliva that is in your mouth is coming, at that place, there is what we call goblet cells. They produce mucus. That mucus is to dilute the acidity from the stomach so that it will not injure the epithelium there. So, if someone is having a lot of phlegm at that place, it can be because of the reflux as well as because of the associated allergy. So, what should the person do? And now, some of the times, this allergy that we are talking about, they say avoid what causes it. We can know what is causing our sneezing or coughing or whatever. Once you know it, whether it is cold, avoid it. If it's any other thing, avoid it. If it's a kind of food, avoid it. I didn't talk much about allergy today because there's no time. But fungal allergy, we use any kind of drug, they hardly respond. And that's why we need to pay proper attention to our environment to reduce the humidity content in our environment. Allergy condition is usually a genetic condition as well as environmental. Genetic in the sense that sometimes you can see a father having allergy, you can see one of the children or two having it. But you can see that as time goes on, when the immunity is changing, you can see that during this COVID, people were having COVID, essentially a respiratory tract infection. Many people develop other forms of superimposed infection because of COVID. If you look at China, look at India, even in the US, the publications on what we call rhinoentomophthalmomycosis, that is a fungal, or we call it, just call it mucormycosis. It's a fungal infection. It comes when something high has come and has beaten down the immunity of the body, especially in the respiratory tract. That one will come as a supplement, as an addition. One you pay tea and laba. But this time around, the other one that come, you can say it's kekere, but it's not kekere because onje oju de agbari. People that have it, sometimes they cannot even survive. We are battling with it. Use various drugs, it will not respond. So that is the situation of things. The second question, sneezing. Identify the allergen and avoid it. Simple. As you see me, let me just say that immunity changes. And I don't want to prescribe drug here. I would have told you that this and this helps. Because if I prescribe drug as a blanket, people can abuse it. But we know what and what used to help. Okay, so if somebody is living maybe in Ikeja, Lagos, or Lekki very soon, or in Port Harcourt, where they see soot like this, soot, because of the refineries, or because of all these modular refineries, or Ikeja, where there are industries, or Lekki now, when Dangote comes on board, those ones, they'll be having these problems. So it behoves on you to know how to use your face mask and other things to avoid what is causing it for you. Number two, if perfume is causing problem, please avoid it. That's the straightforward thing. Yes, perfume can I've actually prescribed for many people to avoid it, and it's helping them. Hole in the mouth, yes sir, there are criteria to qualify for operation. 6 weeks, patient can qualify if the blood is at a particular level. For the lip, if it's for the palate, 9 months or 1 year, the patient can qualify if the blood is at some particular level. In the meantime, they just have to comply with the steps to take to survive till that time. Because, at that throat is bone. They cannot treat it except the muscles around it are a bit stronger. But the one of the lip, and it's going to be used a lot, and it will be there forever. So, in Kotoma Bakale, the time Benyati Bodiese. Yeah. So, exposure to loud noise can cause barotrauma or noise-induced hearing loss. You can use ear muffs or ear plugs. Ear plugs are everywhere. One can get it. Just put it there. I just gave it to somebody who was going to travel to Abuja because that person also was having tinnitus. So all these local aircrafts, they are not well pressurized. Apart from the noise that they call CBN staff that work under the, CBN staff, they work underground. The place is vacuum. Many of them have hearing problems, tinnitus. So you prescribe ear muffs for them and so on and so forth. And those people that you enter small aeroplanes. So you should be using our ear muffs and ear plugs. So vertigo is an ENT condition. Vertigo is basically ENT majorly by, let's say, 50%. Other conditions that we need to look at include systemic condition, diabetes and so on, or eyes, or vertebral column, or gait problem. So, but in 50% of cases is due to vestibular organ in the ear. So the person that had infertility following maybe thyroidectomy, maybe I've explained it. Maybe thyrotoxicosis. So hypothyroidism and infertility, they go hand in hand. But I don't know the reason for the thyroidectomy. It can be autoimmune thyroiditis, it can be thyrotoxicosis. So if it's autoimmune, there may be more problem than just the thyroidectomy. But if it's thyrotoxicosis, they will just give him replacement, and then she should be able to, and then we believe God, because eventually doctors can treat. It is God that give children. Even some people, they can investigate them with the best of facilities. They will not find anything. So I think for that individual, we need to know what is the etiology of the thyroid mass that was removed. One. Then number two, commit it to God in prayers. Who can do all things and who will sort him out. Thank you.